Hi, I'm Dr. Tiffany Denny. I want to show you today some things that you can do to relieve some tension in your neck. So we'll use a ball. This is a lacrosse ball. You can use a lacrosse ball, a tennis ball, a therapy ball, whatever kind of ball you have. And you will need a block. And we're going to work today with a little mobilization of the muscles in our neck. And the really important thing after you mobilize something, like after you release some muscle or stretch muscle, is then to use the new range of motion that you have. So I'll kind of show you how to do that within the context of your yoga practice. So with your ball and your block, you're going to take these things. I'm going to try and turn so you can see a little better here. And your ball's going to go on top of your block. And if you can find this place right behind your ear, and then all these muscles kind of as they go back on the side of your neck. That's what we're after, but we're really going to stay high, like from the top of your neck to maybe the middle of your neck. And you're going to take the ball and start it up right behind your ear, not on the bony part, that doesn't feel good, but near that. And then turn, so you're sort of going to get into like a twisting shape, which I think feels really nice. And you just adjust a little bit. You might have to adjust some because you want to get the ball where it's not going to fall off of your block. But I find this place right at the base of my skull. So now your back arm could be on your hip or it could be open. And now you're just going to turn your head and let the ball roll right along the base of your skull. And you can go all the way to the middle, almost to the middle of your neck, and then take it back. And just as you need to, you might need to move your ball or move your block a little bit if it's not working out for you. And if you find a really good place, you might hold, you might do a little nodding up and down. Please breathe the whole time. And I'm going to take you through this quickly, so if you need to pause the video to do it longer, please do. But you can move it then down just a little bit, so it goes a little lower and deeper into your upper cervical spine, and you would do the same thing, roll, roll, roll. And once you've rolled this side aspect of your neck as much as you want, then you're going to actually come onto your back and take the ball right between the two up and down muscles right in your neck, and it's going to be right up at the top. There's like a divot in there. You're going to sink into that divot and then go very slightly side to side. And so you'll kind of roll right up against those little muscles that go right up and down the side of your neck and attach into your head. And again, if you find a spot that feels really tender, hold there. You could do little nods, or you can just hold and breathe. Take calming breaths. And once you're done with that, you would roll and do the same side element on your other side. And after you have done that, we'll move your block and put your ball aside for the moment, and you'll come to all fours. So when you come to all fours, you want to be nice and open here. So you can see, like, I'm not stretched. Kind of taking this open. Make sure you don't lock out your elbows. But what we want to do is keep a nice, even spine in our back, and the only thing we're going to move is our neck. So we're going to give our neck a little bit of work here. I'm going to let your chin come down and kind of stare at the same place on the floor, and I'm not moving my shoulders. And then when I come back up, I'm tucking my chin in a little bit and lifting the back of my head. Now it's tempting to also puff up in your upper back, but try not to do too much of that and do just a little bit of neck. Not as much as you can do, because as much as I can do would be like this. And I would tuck in really far. I don't necessarily need that. But I'm going to come down and up and add your breath to this. You can breathe either way in either direction. You just pick what feels right. And do a few more like this. Let's say one more. And this time when you get to the top, hold at the top. Keep your head, your chin tucked like it is, and turn. And come back to center and turn the other way. Come back to center and then go down. One more time, you'll lift. Keep that turn. You're not letting your chin come out of your chest, back to center, and then come. So it's not in your chest, but you're not letting your chin lift up. It's staying in and turning. And then down. See if you can do a few like that. And that's a really good way to start to work the motor control and use the mobility in your neck. If you can find the top inner corner of your shoulder blade here, that's where the ball goes. It's going to go on a muscle called your levator scapulae. And then you'll come to the wall. You want your legs to be soft, but your back is going to be on the wall, and you're going to find a place where you can kind of dig into that muscle, but your head can be on the wall. And you're going to start with your arm behind your back, like this. I actually like to get my hips off the wall because I can dig in a little more. So you just see how much you want to dig. I like to dig in and get my hips off the wall, and then get my hand behind me. Your head stays on the wall the whole time. Don't let it lift up, but turn your head. You're going to turn it in one direction. You might feel a little increased pressure sensation, and turn the other way. But you're rolling your head like a rainbow on the wall. And so you might do this for however long you want, right? And you do a little bit, and then you can take your arm up and overhead. Keep it on the wall, your hand will be on the wall, and you're going to do the same thing, turning your head one way and turning it the other way. Keeping the back of your head on the wall. Your levator scapulae attaches into your cervical spine, so this can oftentimes be a really big limiter for your neck mobility, and it can also give you some discomfort in your neck or in your shoulder. Now, once you're done with that, you're going to do however much you want there. Keep your ball where it is and roll so that now the ball is just on the side of your spine, right on some of those big muscles, right beside your spine. I actually like to bend my knees and roll it up a teeny tiny bit, so it's right at the base of my neck, the top of my upper back. And then the same thing, you turn your head. This time you might turn it farther because you want to feel that sensation in there. And then turn it the other way and same, roll your head, roll it on the wall. And so now you're getting a little more head turn with that. And so you're going to do all of that for a while. Come out. You can wiggle your shoulder around. Do the same thing on your other side. Once you're done with all of that, now we're going to take this into some of your standing poses where you are required to turn your head. So if you think back to when we were on all fours and we were lifting, you got that nice lift to your spine, lifting the back of your head. We're going to use that. I'm just in a kneeling side angle. You can do this in any of your lateral standing poses. And I'm using a block because it feels nice. So once you get here, the temptation when we're trying to get into these poses and turn and we feel tight is to put our head forward. We're focusing, we want to jut our head forward. But then if you do that and turn, that causes pinching in your neck. So the first step is if you put your hand right on the base of your skull, here, you're going to lean back, just like if you were on all fours, lean back. And then once you've leaned back, keep pressing into your head into your hand and use your hand to help you turn. So when you turn, you're going to end up with your chin slightly in and we call it smell the armpit, right? Smell the armpit. See if your cheek can get kind of next to your arm because you're hugging your elbow in. And then you could stay here and just notice what that feels like. Or you can see, okay, can I hold my head here and stretch my arm out? And that's how you work into it. I'm not letting my ribs pop forward when I put my head back. I'm keeping them in and pushing my head back. I'll show you from the back. Make sure you can see here. Okay. So, same thing. Lean back. My ribs are staying in. Turn. Hold. give it a try.